Playing a larger and larger role in the future in headache management, primarily with the Neurolens system. There's just really not anything else that we have available that can measure this disorder. I need the optometrist. They don't need me. I'm Dr. Carol Nelson, and I'm a headache specialist. There are probably 250 to 300 actual headache specialists in the United States. The numbers are surprisingly low. So my first introduction to Neurolenses came in about 2011 when I had a patient that I was examining. As she took her glasses off, she told me they were her headache glasses. And my first thought as a skeptical neurologist was, oh brother, what do we have here? And so I sent a letter to Dr. Jeff Kral, who she had gotten these lenses from, and we decided to start a study at that point. I was only taking my most refractory patients. That's just what we were starting with. And we were seeing with that particularly medically refractory group, about 80% were getting some improvement, which is just unheard of in headache medicine. If you get 50% improvement, you're like, that's a true win. So the way the Neurolens plays a role in helping headaches is it helps your eyes work together and therefore decreasing the stimulation into the trigeminal nerve. And the quieter our trigeminal nerve is, the less likely we are to set off all different headache types. I think a lot of the patients that are having the mild daily headaches that we see with trigeminal dysphoria, they're probably presenting to their optometrist initially. And I'm really going to be depending upon them to sort that part out, because I can diagnose the trigeminal dysphoria by what they're describing, but I don't have the machine to test it, and I don't have the ability to put them into lenses. So I really depend on the optometrist to help me in that area. I think the testing for trigeminal dysphoria should be part of every standard exam, because again, we are not going to find these patients unless we're looking, and there's so many out there. But I think the optometrists are really frontline in that. As long as the optometrist has that on their radar and realizes, gosh, this is in my area, this is something I can test for, and this is something I can treat, I think they'll find that there's a lot of patients out in the population that they could also help. I see that in the future, optometry is going to play a larger and larger role. I would like it to, because I think there's so many headaches that are underdiagnosed and undertreated. I would love it if people thought of optometry initially when they had chronic daily headaches.